All right, welcome everyone. Thanks for coming.
Move that closer.
Is it, can you hear me?
Yes. You have to be pretty close to it, though.
Pretty close.
Yes, better.
All right, we're going to get started. Thanks for coming to our information session about our combined sort of bachelor's, master's programs. I know many of you. For those of you who don't know me, my name is Maria Bolzachelli. I'm the director of the Public Health Studies program, so welcome. Just an overview about what these programs are and what they're not, and then we'll hear from each program individually with more details about their own particular programs, and then at the end we'll break into groups. You can see around the room there are names of the 5 different departments that are represented here tonight, and so we can break out and you can ask your own individual questions at that time. So just to start with some general information about what the Bachelor of Arts and Master of Health Science and Bachelor of Arts, Master of Science in Public Health programs are. This is essentially an arrangement that we at the Krieger School of Arts and Sciences and the Public Health Studies program in particular have with the Bloomberg School of Public Health, whereby public health studies majors can apply early to master's programs in 5 of the departments at Bloomberg. Some of you might have been at the general graduate school information session a couple weeks ago, and if you were, but even if you weren't, you saw that graduate programs are really all different, and I can't stress that enough. From one university to the next, and really from one department to the next, even within the same university, graduate programs are just all very different. And so you really need to learn about each one and find out what the entrance requirements are, how long the programs are, what kind of coursework is involved, whether or not it involves field work. So they're really all very different, and what I like to tell students is, figure out what it is you're passionate about, and if you want to go to graduate school, find the best program for you. If it happens to be one of these programs that we have an arrangement with, one of the 5 departments at Bloomberg, then great, you get to apply early to that. So the 5 departments that we have these arrangements with are here in environmental health and engineering, epidemiology, health policy and management, international health, and mental health. So right away you should be saying to yourself, that's only half of the departments at Bloomberg, right? So we don't have these arrangements with all the departments, just these 5. So the way these programs work, you apply at the end of your junior year, and that summer, essentially, you're notified, certainly by the time you start your senior year, you're notified of your acceptance into the program. And so you start your senior year knowing that you're already admitted to this master's program. What it's not, though, is it's a true joint program. You're never actually enrolled in both programs at the same time. You will complete your bachelor's degree, and then you'll matriculate into the master's program. And so it's not a specific degree program all of its own. It's really just a way to, as a benefit to you as a public health studies major at Johns Hopkins, you get to apply early to these particular programs. So some of these are BA MHS programs, and some are BA MSPH programs. And so what is the difference there? So the MHS, the Master of Health Science, is considered an academic degree. The MSPH, or Master of Science in Public Health, is considered a professional degree. If you're one of my students, and we've talked about this, I always say there's tends to be 2 pathways that you can take in public health, and one is research and one is practice. And so these 2 degrees basically represent those 2 branches within public health. The MHS will set you up more to do the research and scholarly activity. The MSPH people will set you up or to do the practice side of things. And because of that, the MSPH programs usually require field work, typically 9 months to a year of field work. So, all right, so when you've identified a program that you would like to enter, if it's one of these programs, you'll apply, as I said, at the end of your junior year. I think the deadline for all of these now is July 1st. There is basically one common application system that's an online system, so you all use that same system. Some of the benefits to doing this, again, you get to know early before you start your senior year if you're admitted to this program or not. One of the benefits of that is, as you know, senior year, we require you to take courses at the Bloomberg School of Public Health anyway. So in most cases, once you're admitted to one of these programs, they'll actually start talking to you during your senior year about courses that you might want to take senior year. So you can really maximize your senior year in terms of the selection of courses at Bloomberg that way. In some cases, the GRE requirement is actually waived. For certain programs, if you have a GPA above a certain level, then the GRE requirement may be waived for you. So if you're not a big fan of standardized tests, you might see that as a big benefit. And again, for some programs, you can actually transfer in up to 16 credits of coursework that you actually take during your senior year. So that could be a benefit as well. And if you happen to take certain courses that are required for the master's program in your senior year, then that actually also can transfer into your master's program, and you have already, in some cases, done some of the required coursework. So there are some benefits to doing this. So we have some information on the table by the door. We have information sheets for each of the 5 departments, and we also have one summary sheet. If we run out of those, don't worry, we will actually post all of this information on our website, so you can always get it there. But this is a summary, and as I said, you can see they really are all different in terms of what the degrees are, how long they're going to take. And so each department now is going to come up and talk to you about their specific programs and their specific requirements. So we're going to actually start with environmental health and engineering. I'll introduce Dr. Megan Latshaw to tell you more about that.
All right, so who's taking the environment in your health? All right, so what's killing people nowadays? It's a leading cause. Actually, all public health studies majors should know this, right? What's killing people? Shout it out.
Everything.
TB, malaria. What's killing the most people? Heart disease, good one. Others? All right, I won't put you on the spot anymore. Actually, I got ahead of myself. I started walking and I forgot where I was going to start. So first I wanted to start actually and talk about different career paths related to environmental health. Because I think, you know, as a student, I'm a grad. I went undergrad here as well. But we didn't have a public health studies major when I was here. So, and we didn't have this gorgeous age now either. But I think when I was an undergrad, I didn't know what environmental health was. B, I didn't even know what public health was. So I like to give people an idea that environmental health is huge. You can be anything in environmental health. So you could be, I should have changed this. You guys know what an epidemiologist is. Sometimes when I talk to folks outside the field, I just call it a disease detective. You can be a laboratorian, an inspector. My 8-year-old thinks inspector is super cool. Toxicologist, biologist, chemist, physicist, mathematician, physician, nurse, lawyer, I don't know why it's bouncing around, social worker, first responder, communicator, policymaker, teacher, planner, community activist, and for those of you who don't know, we just merged with the Whiting School of Engineering's Department of Geography and Environmental Engineering, so engineer should be on here as well. My point is you can be anything and work in environmental health. I can name at least one person in every single one of these categories that works in environmental health. All right, so I guess I did take out my slide about what's killing people. So basically, it's chronic diseases. And back when I was a student, we thought that the Human Genome Project was going to magically solve chronic diseases. We were going to be able to tell you by looking at your genome what was going to make you sick and what was going to kill you. Has that happened? No. So where we are now in the field is we think it's a combination of environment and genes. So it's not just your genes, but it's how they interact with the environment. And epigenetics is a big part of what we look at in environmental health and how our environment modifies our genes. So not necessarily changing them, but just modifying them. So like I said, we're across this Whiting School of Engineering and the School of Public Health. The goal of our department is to discover, disseminate, and apply new knowledge related to how the natural, built, and social environments impact health. So we're not just looking at chemicals. We're looking at systems. We're looking at, actually I'll get into it, I don't want to get ahead of myself, but our focus ranges from global all the way down to the molecular level. So I mentioned epigenetics. We also look at basic molecular and cellular biology. We have a lot of laboratories in our department. And they are basically trying to figure out what environmental stressors do to our bodies physically. They're trying to solve cancer. They look at respiratory illness, cardiovascular disease, obesity. We also, access to nutritious, safe food is not a given in a lot of parts of the world, even in our own country here in the United States. And so our department focuses on food systems and how to create sustainable food systems and food production and consumption, and also waste. Food waste is a big part of what we do. Air pollution. So I don't know if you guys saw, but or if you know this, but air pollution is linked to more deaths than HIV and TB combined around the world. Air pollution kills a lot of people every single year. So we try to figure out how that's happening and then develop innovative solutions for addressing it. Clean water, access to clean water is again something that we might take for granted, although even in our own country, it's not always the case. Look at Flint, Michigan as an example. And actually around the world, do you guys know what the second leading cause of death in children under 5 is? Think about the slide, think about what bad water causes. Diarrheal diseases, absolutely, good job. Thanks for not making me stand up here, Taylor. And so we look at water scarcity, we look at water security, we look at water safety. And then there's our changing planet. Of course, we have to talk about climate change, right? And that goes back to energy choices and where we get our energy from and how we've designed our communities around cars. And really what we need to design communities around is people. We need walkable communities that are safe, that encourage people to get out there, to make social connections with green spaces, because nature has been shown to decrease stress. And so our department is looking at things like fracking and climate change, and the food systems and energy and population changes. So we not only do science, everybody knows Hopkins is famous for research, right? But our faculty members also testify before Congress. We work on policy, we work in practice, so we work with the Maryland Department of Health and departments of health around the country. So it's not just research, we do a lot of other parts of public health as well. And these are just some of our students basically trying to show the cross-disciplinary nature of what we do. There's the lab, there's people that are out responding to emergencies, there's people who are in workplaces trying to make them safer, and then people all around the country. So we are everywhere doing everything. All right, well, what about the degrees? That's what you guys came to hear about, right? You guys already know all the environmental health stuff, right? Because you took environment in your health. So we have 3 options in our department. You can get your bachelor's and your MHS, your SCM, or an MSPH. The first one, the MHS, is sort of the broadest and the fastest. It says up here it's a 1-year program. It's actually only 9 months, so it's one of the fastest programs in the school. It's purely academic based, so you're just doing coursework and an essay at the very end where you try to tie everything together. There are 3 focus areas, but you don't have to pick a focus area. You could just design your own program. And the 3 focus areas are human toxicology, pathophysiology, and risk assessment. I think of that as the lab-oriented focus area. There's population environmental health, which I think of as more of the epi focus area. And then there's food systems, water, and environmental sustainability, which I think of as like the systems approach to everything. Our SCM is basically the MHS with an extra year tagged onto it where you do research. So you still take all the same classes as the MHS students. Instead of doing an essay, you do a proposal for research. And then in the second year, you actually implement that research. And by the end of it, you'll have a thesis, hopefully that maybe someday could ultimately be published if you kept on in that vein. And then lastly, we have the MSPHs. These are for people who want to just go on and be professionals, who aren't even thinking about getting a PhD or an MD. They just know they want to go out in the real world and do stuff. Although an MHS and an SCM are fine for that too. The MSPHs are 16 to 24 months. They involve both coursework and an internship. So your second year is an internship where you're out working in a company or in a government agency or something like that. There's 2 tracks, occupational and environmental hygiene, and there's also toxicity testing and human risk assessment. That's it. We'll do questions at the end when everybody's
Yeah, we're going
at
to
the
break
tables.
out by department at the end. So
Great. Thanks for participating.
Thank you. Hi.
Well, my name is Terry Beatty, and I'm in the Department of Epidemiology. And I'm here to tell you about the department, its purpose, what it means, and then the details about the VA MHS program. So epidemiology is the study of diseases at a population level. And our mission is to improve public health by training people and advancing knowledge, considering largely the causes and the prevention of disease. If you understand the cause, you can think about how to prevent it. And then you can understand how to promote health. And our department is the oldest autonomous department of epidemiology in the world. And it's the largest department in the, it's not the largest in the school, but it's been part of the public health, School of Public Health, pretty much since the beginning. It's originally called chronic disease as opposed to infectious disease. So epidemiology is an observational science. We collect data, we analyze data, we draw conclusions from our analysis. And what are we looking for generally? We're looking at the population level to see how a disease is distributed and try to extract from that information what is the cause. Because the distribution, in part, represents the etiology or the cause of disease. And if you understand, as I said, if you understand what causes the disease, it creates opportunities to intervene, and you can intervene at a medical, a environmental, or a policy level. So the ultimate goals of epidemiology are to identify causal agents or simply risk factors that increase your risk, and to eventually develop effective methods of control and prevention. So our focus includes identifying and confirming risk factors for disease, evaluating intervention strategies, and building a scientific foundation for public policy. So, as I said, it is a largely observational science, but there is an experimental arm if you're doing a clinical trial. We've got 2 groups of patients treatment A, treatment B, follow and see which one is better. So there is an experimental side. There are many tracks, academic tracks in epidemiology. We have the group that focuses on cancer. Number 2 cause of death in this country. And then the clinical and cardiovascular disease epidemiology focuses on heart disease and anything related to heart disease, including vascular diseases like kidney disease and diabetes, the number 1 cause of mortality. We have a program in clinical trials and evidence synthesis method. How do you compare treatment A to treatment B? How do you look at the literature and review everything out there to figure out if what we're doing today is helping, hurting, having no effect? We also have a track in the epidemiology of aging. Our country is getting older collectively. And we have environmental epidemiology. And then there's kind of a general methods kind of epidemiology, general epidemiology and methodology that's what is the best way to analyze the data to get a question answered. And my personal favorite is genetic epidemiology because exposures are not the only thing that determine your risk. Some of those inherit genes. The largest program within the department is the infectious disease epidemiology, and that deals with a full range from laboratory to policy and everything in between. Some of the sample projects that we have ongoing in our department, and you can get a thesis out of them, are large cohort studies of at-risk people for infection with HIV. There's large AIDS cohorts, and then we have both cohort and case-controlled studies of cardiovascular disease and kidney disease. We have community-based samples to identify causal factors for common cancers, prostate, breast, colon, and other cancers. The genetic epi program focuses on cohorts, family-based studies, hospital-based studies of autism, birth defects, asthma, kidney disease, eye diseases. And then, as I said, we have the clinical trials branch, or the clinical trials track, which is experimental in design, may or may not involve laboratory experiments. But it would certainly make you very attractive to pharmaceutical companies who need to do this and need to do it quicker and cheaper and faster. So I'll be happy to answer any questions during the question and answer period. And we also have our academic coordinator, Frances Berman, so she knows all the rules. And I'll turn it over to health policy.
Thanks. Hi, so health policy and management, here's our mission statement. It's a big department that does a variety of things from social policy to hospital quality improvement to outcomes research, economics, and other areas. To give you an idea of sort of the breadth of what happens in the department, these are our related centers. I don't know if you can read them very well, but they go from a number of collaborations with medicine, the operations side at the hospital, to big data projects that build evidence for policymaking, to the more legislative and legal aspects of policy, and collaborations with a number of our departments, a lot of with EPI, with environmental health in the risk sciences area, and other areas. So I won't read all of these because information, but these centers I think are a good way when you're researching programs at the School of Public Health generally and the department in particular to get a sense of the kinds of work that the faculty are doing in the department and the kinds of research that you can get involved with when you are a student. The degrees that our department offers, so we have, the one that we'll highlight today because of the topic of the session is the Master of Science in Public Health and Health Policy. So that's the only one that we have an early admission track for in health policy and management. But during your senior year, you could also apply for MHS in Health Economics, MHS in Health Finance and Management, MHA program, the MPP. That's actually, the program is actually paused, so we're not taking applications for next year if anyone's a senior. But, and then we also have doctoral programs. Our PhD tracks are in bioethics, economics, health services research, and public policy. So to go into a little bit more in depth about what the MSPH in health policy is about, similar to the MSPH in environmental health sciences that you heard described a bit earlier, it's a year of coursework and then a year of field placement. So the field placement year typically is paid full-time employment. So essentially while you're doing your intensive coursework year, first 9 months of the program, you are also gearing up to find your initial health policy job. And then during the second year, you're essentially a full-time worker and a part-time student. The actual academic requirements during the second year are fairly light. There's 2 group projects with oral presentations that are given at our symposia where we get our second and first year students together. And then there are 2 short papers. And students can also take additional elective courses from the online offerings, or if they're or if they're nearby from the on campus. The curriculum basically consists of courses in 4 core public health areas, several courses related to U.S. health policy, and then there's some elective room, more elective room if you take courses during the second year. During the second year, 75% of the tuition during that year is covered, so you pay just a quarter of the tuition in year 2. The kinds of jobs that people get coming out of the MSPH in consulting, especially with like boutique healthcare consulting firms or in the healthcare wings of the larger management consulting firms, the federal government, state and local health departments, and the insurance industry. So all the Medicaid, Medicare, all the issues that are sort of right now up for grabs in the health reform debate is the area where our students work. The pharmaceutical and medical device industry also hires health policy analysts in some cases. HIS, nonprofit organizations, advocacy groups, and think tanks. Those could be both, sort of industry-based advocacy groups or advocacy groups around a certain issue. I thought I had more, but it looks like that's it. I'll say the additional thing I want to say is with the elective courses, you can focus in a particular policy area. So you can leverage the other offerings that are available at the school, like in women's and reproductive health, in child and adolescent health, in environmental health, and community-based public health, and have sort of a sub-focus in your health policy, but it is essentially focused on U.S. health policy. So if you're interested in international health policy, let's go to the next group.
So there's the short woman has to do this. Hi, I'm Karen Sharon. I'm one of the academic coordinators for our Department of International Health, and I'm with Ellie Lancini.
Don't need to be
Standing on my toes. There we go. There we go. And so I'm one of the academic coordinators for the Department of International Health. Ellie Lancini is the academic coordinator for social and behavioral interventions, and I'm with global disease epidemiology control. And Christina, who's here with us, is the academic program manager for the department, somebody who, if you're going to apply, you would want to know. I just want to say, how many of you think there's a difference between international health and global health? What would you say the difference is between the two? We're the Department of International Health, not the Department of Global Health. Anybody taking global health things? There's a lot of global health programs that are popping up, but our department was founded on the basis of internationalism, the working with nations, working in collaboration, supporting international organizations like WHO, World Bank, those international organizations, and then with the local organizations. So not all solutions are global. Many solutions are local. So we're working with underserved populations. So we are the Department of International Health. Our department is very large. It is the same size as the 5th largest school of public health. So we've got a lot of faculty and a lot of projects. So we have a brochure that you, if you're interested, can pick up. Where can international health take you? And I would encourage you to take a look at that, because there's a lot of different types of projects that we work on. So this is our mission, and you see up here that we're looking at disease reduction and health promotion. I would say we're a very applied department, and that we're really working with underserved populations across the world. We predominantly work with low and middle income countries, but we work really with underserved. Some of our faculty work domestically as well as internationally, and on various types of interventions to improve health. So this is what was already shown to you for the other departments, how it would work. You would apply in your junior year, and we would like people to have a GPA of 3.3 or above, to not take the GRE. If you have below that, if you take the GRE, you could be considered. You would be getting an advisor, and you would take the credits in your senior year and have a mentored type experience of helping you select what courses you take in your senior year to help you, to better prepare you for the Masters of Science in Public Health. In the first year, you would do coursework, 9 months of coursework, and do 64 credits. And the application process also involves letters of recommendation. And you use the Sophis Express to apply. So there are 3 programs in our department that have the BA component. 2 of them are BA MSPH, and 1 is BA MHS in health economics.